Welcome back. Now, we're still in the beginning of the year, and over our past few health segments, we've been doing what we can to prepare you for what you need to do to check yourself. Check out every aspect of you health-wise. Now, today we're focusing on the women and important health checks women need to do annually. And of course, we have Dr. Munisola Adanijo here with us again. She is the co-founder of Naveen Healthcare. And right now, with medical experience spanning over 24 years, she's built her pathway in medicine and cardiology, working in the public sector. And well, it's really great to have someone as reputable as you here talking to us about this. Welcome back to the show.
Thank you for having me back.
All right, so yes, we're focusing on the women today. We've done the cardiothoracic, we've talked about those major checks and how the process of how those checks are done. But now for the women, what are the key checks that they need to do at the beginning of the year?
Okay, so for women, we need to do our breast checks and our cervical checks.
Okay.
Apart from the monthly self-breast exam that we all need to do in our homes every month.
Okay.
We also need to do a mammogram or a breast scan. Now, who does what? When you're above 40, it's advised to go for the mammogram.
Okay.
Because the breasts are less dense. Now, a mammogram is like an X-ray, a soft X-ray of the breast. And if you're younger than 40, because your breasts are more dense, a breast scan, just like an ultrasound of the breast. So what are they looking for? Possible lumps or anything that could be whether pre-cancer or cancer itself. Okay, and so your pap smear is also very important.
Okay.
Now the pap smear checks the cervix. Now what is the cervix? The cervix is the neck of the womb.
The neck of the womb.
Yes.
So is this, the neck of the womb, is it closer to the exit?
Closer to the exit.
Closer to the exit, okay, all right.
So they do that by inserting a small brush.
A brush or like a cotton swab or something?
A brush.
Okay. A brush, okay.
Or a spatula.
Oh, okay.
And they do that and they collect the cells. And they take it to the lab to check if there's any precancerous or cancerous lesion.
Wow.
Now, it's advisable you do pap smear as soon as you're sexually active.
Oh, wow, okay.
And then if it's normal, 3 years subsequently.
So when you say sexually active, there isn't really an age group we can put on that these days. There was a time that it was probably from, what, 21?
Yes.
But in 2024, it's probably as early as 17.
Yes.
So there's
Even earlier.
Even earlier?
So that's why this drive to immunize with HPV vaccine is going on.
Okay.
We want to immunize young girls because cervical cancer is thought to be caused by this virus.
Okay.
And it's sexually transmitted.
Wow.
So it's important you immunize your girls when they're young, before they're sexually active, such that they're protected.
All right.
Then when you get sexually active, you do your pap smear every 3 years, if it was normal at the first instance.
Okay, so we've covered a mammogram and breast scan. We've also covered the pap smear. There's one more you mentioned.
The pelvic scan.
Okay.
So the ovaries, are also exclusive to women, obviously. Men don't have ovaries. And the only way you can check them is if you actually go and scan them.
Okay.
So you can do a pelvic scan to check your ovaries. Now, what are you looking for? Masses in the ovaries, cysts and things like that, which could be benign or it could be malignant. Now, because the ovaries are so deep in, ovarian cancer doesn't quickly show. There's no swelling, there's nothing until maybe it's too late. So a pelvic scan looks at the size of the ovaries and looks at if there are any masses or if there's anything wrong with the ovaries.
Okay.
So those are really important.
So now the ovaries are where, eggs are released. To the best of my knowledge, eggs are released and women have their periods every month.
Exactly.
So if a woman is having regular periods, no, irregularities going on there, they probably haven't really considered anything like a pelvic scan before. Is there any irregularity in that regard that might trigger a need for that scan?
Okay, so we're talking about health checks when you're normal.
Okay.
Okay.
All right.
So by the time you have irregularities, you have period issues, there's already a problem. So we're talking about the people who think they're well, who are otherwise perfect. Nothing is wrong with you, but you're going to check yourself to make sure everything is still fine. So these people are the ones we're talking to this morning.
We've actually talked a lot about the reproductive areas of the body for women now. What about women who are at that point where they're pregnant? Do they still need to go for such checks?
So when you're pregnant, you go for your antenatal anyway.
Okay.
And when you go for your antenatal, you know, they check you, are you okay? They do your scans, they do this and they do that.
Yeah.
You may not have a pap smear when you're pregnant for obvious reasons. Nobody wants to go and disturb your womb when there's a baby there.
Okay.
But, you know, because you're going to hospital for your antenatal care, questions are asked, examinations are done, and things may be picked up, you know, if you were faster than if you weren't pregnant.
Okay, all right then. Let's hop, skip, and jump back to the mammogram.
Right.
Now, there are people that don't understand what happens during the mammogram process because it feels very intrusive. Can we just say exactly what the process should be like?
Okay, so first of all, before you go for your mammogram, they tell you not to use any body creams, not to use roll-on or sprays because that may occlude whatever it is they're going to see.
Oh, okay.
So when you get to the scan room, you know, you're educated, oh, this is what the mammogram is, this is the machine.
Okay.
You have to take off your top.
Okay.
And they give you like a robe or a gown to wear.
Like that, okay, yeah.
Right, exactly, like that. And then when you wear the robe or gown, they expose the affected breast, and they put it on the machine.
Okay.
Now, the machine has two parts. There's a bottom part and there's a top part. So they compress your breast between the two parts of the machine.
Okay.
And then they shoot a soft X-ray, and then they take
they take pictures of what's going on in there.
Exactly.
So that
they do that for both breasts.
Okay. So it's not really a long process. Maybe what, 30 minutes?
Yeah, about, because they take different views of each breast.
Okay,
You know,
all right.
So that to get all the angles.
And the test results don't take time to come out, do they?
Well, it depends on pressure, obviously. Someone has to report it. The
Okay.
radiologist has to report it.
Okay.
And with this Jacques syndrome, you know, there may not be too many people. But ideally, by 1 week, you should get your results.
Okay, all right. Fantastic. Now, you mentioned that for younger people, the breast scan is an option. So is it similar to the mammogram or?
It's just an ultrasound.
Okay.
Where they use the normal ultrasound probe.
Okay, like a wand.
Sound waves, exactly.
Okay.
So it's the same basic thing. You lie down, you expose your breast. This time, they put a gel on your breast so that they can eliminate air for proper transmission of the sound waves.
Okay.
So they just do the scan, all the segments of the breast, looking for any abnormalities.
All right. That sounds simple enough. Not intrusive at all. Very simple. But yeah, the pap smear is a little bit more intrusive.
Yeah.
So what to expect?
Okay, what to expect? So when you're going for a pap smear, you will have to take off your underwear.
Of course.
Lie down with your legs apart.
Okay.
And then because they need to get to the neck of the womb, they have to see the womb, and they can't do that from the outside.
Yeah.
They put what is called a speculum.
Okay.
Okay, it's like a plastic, sometimes metal, but now we all go for plastic because it's disposable.
Okay.
A plastic speculum, they open it out to expose the neck of the womb.
Okay.
It's uncomfortable, but it's not painful.
Okay.
And then once
it's not supposed to be.
So once they see the neck of the womb,
they
put in the spatula, they turn it around.
Okay.
They either put it on a slide, or they put it inside a liquid.
Okay.
They put in the brush, they turn it around, put it on a slide or in the liquid as well.
Okay.
And it's over. Remove the speculum, and you're done.
And you're done.
With good hands, it shouldn't take 10 minutes.
Okay. All right. Okay, so that process, so all of these processes could probably be done in one day.
Definitely.
Okay, fantastic.
Take the blood, take the urine, do the mammogram, and the pap smear.
And by God's grace, everything will be fine.
Perfect.
At the beginning of the year, these are just some of the checks that women are supposed to take. But if, for instance, a doctor has seen some abnormality and doesn't want to actually say it, because I know there are some doctors until they have a confirmation from a test result, they don't want to say anything yet. What are the sort of red flags that doctors look out for before asking a woman to go for such tests?
Okay, so if you have, maybe you did your breast self-exam and you felt a lump in your breast.
Okay.
Or you have nipple discharge.
Okay.
Or some kind of rash on your breasts that look kind of strange.
Okay.
Then they will then go for a mammogram.
Okay.
Or maybe if you have abnormal bleeding from your vagina. Or you have postcoital bleeding.
Okay.
Or you have some kind of discharge that you don't really understand.
Okay.
They may ask you to go and do a pap smear to just check the neck of the womb to see what's going on.
Dr. Moni, it's always great to have you here, and I feel enlightened, actually. I hope someone out there has learned something new today. This was focused on the women today, and next week, we can
talk about the men.
Yeah, we'll talk about the guys. They will be all right. The guys will be all right till next week.